Hello everyone, my name is Josh Ng. I'm your caring pharmacist. In conjunction with our Jom Jaga Jantung campaign, today we'll be discussing more about heart health. And today our session is very interesting where we're talking about erectile dysfunction known as ED. Do you guys really want to know what is the connection between ED and heart health? Today we're very honored to invite a special guest with us, Dr. Warren Law, a consultant neurologist. Welcome, Dr. Warren.
Hello, George. Hello, everybody.
Very nice to have him here. So, doctor, during your practice years, right, I believe that you encountered a lot of patients with ED problem and maybe with heart problem together as well. Is there any close relationship between them?
Definitely, because many people are not aware that those patients with a cardiovascular disease, in short, as heart disease, 50% of them may actually have erectile dysfunction. The reason is because, can you imagine that those people with hypertension, diabetes, or even high cholesterol patients mostly are having some form of a narrow blood vessels. And we do know that those patients with a narrow blood vessels essentially is because of the fact that they have cholesterol flat path in the blood vessels. So naturally, this narrows the blood vessels. As we know, the cavernous artery, which is found in the penis, is very similar to the coronary artery in the heart. But the coronary artery in the heart is actually slightly bigger in diameter as compared to the cavernous artery, which is in the penis. When you start to have arteriosclerosis, basically it's a fat plaque which is plugging the blood vessels. It all starts off with the smallest blood vessels, which is found in the penis. And that's the reason why insufficient blood flow that goes down to the penis will often lead to erectile dysfunction. So if you were to imagine, if you don't have enough blood that goes down to the penis, what will happen? It's a limp penis that you're talking about. So naturally, insufficient blood flow go down there. Erectile dysfunction is a warning sign because ultimately what happens is that you can imagine that there's also insufficient blood flow that goes to the coronary artery. Then of course, people may actually manifest with all sorts of cardiovascular disease such as cardiac event, myocardial infarction such as heart attack, strokes, and so forth.
Interesting. So doctor, just now you shared about there's a close connection between both conditions due to the vessel, right? So can I know that I believe that there are actually both conditions sharing very common risk factor as well. Can doctor enlighten us on the risk factor?
Well, the risk factors in erectile dysfunction many people are not aware of, apart from the cardiovascular disease, means narrowing of the blood vessels, hypertension, diabetes, high cholesterol, and those patients who actually have neurological conditions, for example, stroke patients, any nerve injury patients, and those patients with a hormonal impairment, for example, those andropause men, may actually end up with an erectile dysfunction. Not forgetting that there are actually a large number of young patients are suffering from erectile dysfunction as well, mostly due to psychological factor.
Wow, I never know that they share a lot of common grounds together, like what doctor mentioned, the high blood pressure, the high cholesterol, and diabetes as well. I think all of these chronic conditions are actually very common in Malaysia itself.
Yeah.
Since doctor mentioned about there's a close link together, is there any possible evidence or statistic that you can actually share with us?
Yeah, many people do not know that up to about 50% of those patients with a cardiovascular disease actually have erectile dysfunctions. So if you were to look at the statistics, up to about 40% of those patients with hypertension have erectile dysfunction. 42% of those patients with the hypercholesterolemia or high cholesterol level has erectile dysfunction. And up to about 30% of those patients with diabetes also have erectile dysfunction. Can you imagine that? And all these are grouped together as metabolic syndrome.
Wow, never know that. It's so interesting that most of the ED patients having 50% of cardiovascular disease. I believe that cardiovascular disease not just involving heart as well. It could be like other problems like stroke. So that if the patient first experience ED problem, should they consult doctor immediately? What do you think, doctor?
Of course, that goes without saying. So you just imagine that when we talk about erectile dysfunction, quite clearly mentioned that it is an indicator for the future more disastrous problems such as strokes or even heart disease. So you probably do not know that those patients with the erectile dysfunction have up to about 60% risk of developing myocardial infarction, which is heart attack, 39% risk of developing strokes, and even 25% of death rate. So it is obviously a very alarming factor for everyone.
Wow, doctor, I think that's a very informative session that I include myself. I learned a lot from you as well. So doctor, before we end this session, do you have any take-home message from us?
Absolutely. So men out there, don't be shy. When you suffer from erectile dysfunction, it could mean something more disastrous, such as heart attack, strokes. So don't stay away from the doctor. If you have any problem like erectile dysfunction, come and seek help so that we can identify the underlying medical problem. For all you know, you may save your own life.
Wow, doctor, that's very important take-home message.
Absolutely.
Alright, so guys, I think that don't be afraid to go see doctor about this because you are not the only one. And when you go see doctor, please to get screened as well for the high blood pressure, cholesterol, or diabetes as well, because all of these are risk factors for getting ED. And ED is connected to the heart health as well. So I think that's all. Thank you, doctor, for your time.
Thank you, George.
No problem. Take care, guys. Till next time. Bye-bye.
Bye-bye.